welcome. Thank you for joining us today for our webinar on measuring the financial health of low to moderate income consumers. My name is Linda Williams, and I am a community outreach and training manager with Consumer Action, and I am thrilled, absolutely thrilled, to have so many of you here to discuss this crucial topic, which directly impacts the work that we do with LMI communities. Understanding proper financial health is about so much more than just a single number. It's about building resilience and creating sustainable opportunities for the future. Now, before we get started with our discussion, I want to express our heartfelt gratitude to our sponsor, Wells Fargo. Their generous support has made this webinar possible, and we are truly grateful to Wells Fargo for this particular opportunity. Now I want to go over a few housekeeping items to streamline, to make sure that we have a streamlined and efficient experience for everyone, respecting your valuable time. We understand that your time is precious, and we want to do our best to make this webinar a worthwhile investment of your time. This is a 90-minute webinar that is being recorded. You will receive access to the recordings within a week, along with the PowerPoint slides used by each speaker and any accompanying handouts. Your questions are not just welcome, they are essential to the success of this webinar. We value your interaction and would appreciate hearing from you. To submit your questions, simply type them into the designated box at the bottom and click submit. At the end of our presentations, Nelson Santiago, my colleague, he's going to lead a question and answer segment with our fabulous guest speakers. This is your opportunity to engage, so put those questions into the designated box. Also, before you sign off today, please take a moment to complete the brief survey evaluating today's training. Your input is highly appreciated, and it will help us understand if we met your expectations today. For those of you who are not familiar with Consumer Action, let me tell you a little bit about my organization. We are a national nonprofit. We are dedicated to education and advocacy. What sets us apart from other organizations is our unique approach and our commitment to serving all consumers. We empower consumers by providing multilingual education materials, engaging in community outreach, and addressing important advocacy issues. We take great pride in our work with limited English speakers and other underserved communities across the country. For over 54 years, Consumer Action has been that trusted partner for consumers on their financial journey. Our long-standing commitment and extensive experience inspire confidence in the communities that we serve, ensuring them that they can rely on our support. Now, before you sign off today, please take a minute and explore our website. And while you're on our website, download our latest free fact sheet on money drains, which offer valuable insight into common budgeting pitfalls and how your clients can avoid those pitfalls. Now, let me dive into today's presentation. Again, I am deeply grateful for your interest in this topic, and I'm pleased to introduce the knowledgeable and passionate individuals who will be sharing their insights with us today. Our first speaker is Andrew Bourne. He is a financial health researcher at the Financial Health Network. As manager on the research team, Andrew transforms both survey and administrative data into deep insights about consumer financial health. He believes the most critical social justice issues we face today are intertwined with health disparities, and he seeks to expand the reach and the impact of the Financial Health Network's research to address these issues head on. Andrew analyzed data for a range of research and consulting projects, including the Financial Health Pulse, which is the organization's key research initiative on financial health in America. Before joining the organization, he developed his research skills as a policy analyst with the Urban Institute. He is also an alumnus of the AmeriCorps Vista program, which matches participants with organizations to create or expand anti-poverty organizations. Andrew holds a bachelor's degree from Lewis and Clark College, as well as a master's of public administration with a certificate of advanced study in data analytics for public policy. Molly Barackman-Eder is our second speaker. She is the Director of Financial Capabilities at NeighborWorks America. Molly designs financial capability initiatives for nearly 250 nonprofit organizations across the United States, including the District of Columbia, Puerto Rico, and tribal lands. Now, NeighborWorks organizations integrate financial capability services with community development and affordable housing activities. The diverse network serve people along asset building continuums, help them stay in their rental residence, purchase homes, and achieve financial goals. Prior to joining NeighborWorks, Molly was a financial wellness manager at Goodwill Industries International and staff assistant for the Senate Committee on Appropriations and Rules and Administrations. Molly earned her MBA from Georgetown University and a BA in Political Science from Western Michigan University. I would like to welcome both Andrew and Molly to the webinar. And now, without any further ado, wait, I have Lisa Price on. So before I introduce Andrew, let me turn to Lisa so that she can welcome you and give you her insights about the webinar today. Are you there, Lisa?
I am. Thank you, Linda. And hi, everyone. Welcome. Thank you so much for joining the webinar today. You are in for a treat. Linda and our speakers have a great agenda lined up for you today. Sorry about that. I did want to just share that Wells Fargo is committed to helping communities thrive. Specifically, we really support financially resilient families, vibrant small businesses, and affordable places to call home. And we thank you so much for joining today, and we look forward to your engagement throughout the webinar. Thanks, Linda.
Thanks, Lisa, and thanks again to Wells Fargo for their support. Now, let me turn it over to Andrew. Andrew, let me give you control. You should have control of the mouse, and you should be able to navigate your presentation. Welcome again,
Okay,
Andrew.
thanks so much, Linda. Yeah, thank you so much, and thank you to Consumer Action for having me. Really looking forward to this presentation. Let me see if I have control of the slides here. There we go. Okay, so I'm going to start off with a brief overview of who we are at the Financial Health Network and what we do. I am then going to talk a little bit about what financial health is and how we measure it. And then I'm going to pivot a little bit to talk about one way we measure financial health, which is through our Financial Health Pulse research, which is a project that measures the financial health of households across the US. And then finally, I'll end with a few thoughts on how you can implement financial health measurement in your own organization. So starting off with an overview of who we are at FHN. We are a national nonprofit with the mission of improving financial health for all, especially the most vulnerable communities. And we do this by, first of all, maintaining a membership network of financial institutions, community organizations, employers, fintechs, all kinds of organizations and institutions that have a shared financial health mission. And we provide consulting services to these organizations. We convene and connect these organizations together, and we also inform the public through our grant-funded research on financial health, which is the part of the business that I work in. So financial health is in our name, of course, and it's at the heart of our mission statement, but what does it mean exactly? So at FHN, we define being financially healthy as when your daily financial systems have made you both resilient to economic shocks, so things like job loss, illness, car repairs, both expense shocks and income shocks, and then also able to achieve your goals in the long term. So thinking about things like retirement, home ownership, saving for a child's college education, etc. So there's both a short-term resilience and a long-term goal achievement aspect to how we define financial health. But it's important to us not to just to be able to define financial health conceptually. We actually also want to be able to measure it objectively. As we know, what gets measured gets managed. So the primary way that we do this, which is going to form the basis of most of my presentation today, is with our financial health score survey framework. So this framework consists of 8 survey questions that map onto 8 indicators of financial health across 4 what we call pillars of financial health. And those pillars are spend, save, borrow, and plan. So under the spend indicator, we look at whether a household is spending less than their income, whether they're able to pay all their bills on time. Under the save pillar, we're looking at both short-term or liquid savings and long-term savings, things like retirement, home ownership, etc. Under the borrow pillar, we're looking at debt manageability and credit score. And then under the plan pillar, we're looking at household insurance and planning ahead financially. And then with our scoring framework, we take a person's response to each of those survey questions. We assign a point value to each response. Basically, we average them all together, and the result is a score on a scale from 0 to 100. On this scale, if you score from 0 to 39, you're considered financially vulnerable. If you score from 40 to 79, you're considered financially coping. And if you score from 80 to 100, you're considered financially healthy. In plain English, what that means, or how we interpret the results of this, is if you're financially vulnerable, you are struggling with almost all aspects of your financial life. So almost all of those 8 indicators of financial health. If you're financially coping, you're struggling with some, but not all of those indicators, thriving in some areas and struggling in some other areas. And financially healthy people are struggling with few, if any, of those 8 financial health indicators. So dozens of organizations are using this framework across the country to assess the financial health of their customers, their clientele, and even their employees. And towards the end of this presentation, I'll talk a little bit more about what implementing this actually looks like. But first, I'm going to walk us through how we use this scoring framework to measure the financial health of the nation as a whole. So each year we publish our Financial Health Pulse Trends Report, which serves as an annual update on the financial health of households in the US. The objectives of this report are to, first of all, just share the state of financial health of households in the US in the most recent year. Then to document how financial health has changed, both in the population overall and also across different demographic and socioeconomic groups over the past year. And then finally, to report on trends in overall financial health and the 8 financial health indicators that I mentioned since 2018, when we began this project. We field each survey annually through the University of Southern California's Understanding America Study Panel, which is an online nationally representative panel. This year, the survey was fielded between April 11th and May 19th. We always field it in English and Spanish. We get about 7,500 respondents a year, and this sample is designed to be nationally representative of US households as a whole. But getting into the findings from this year, we lead off this year's report with a big picture view of how financial health has changed over the past 8 years. And in short, if you look at just the beginning and the end of this time period, the short answer to this is not much. But each year we publish this chart showing the share of the population that is financially healthy, coping, and vulnerable according to that scoring framework that I was talking about. And as you can see here, financial health did increase substantially during the first 2 years of the pandemic. So in 2020 and 2021 here, you can see that the percentage of the population that was financially healthy increased pretty substantially from 29% to 34% over that time period. This was, of course, due to both the fact that we had enhanced government social safety net during this time period temporarily, and we also had temporary restrictions on how people could spend their money because parts of the economy were shut down during these years. But these improvements were short-lived, as you can see here. And the share of households that are financially healthy has been roughly steady since 2022, hovering around 30 or 31%. That said, looking at just the past year, 2024 to 2025, the share of households that were financially vulnerable actually decreased a little bit from 17% to 15%. So not a huge change and nothing unprecedented when you look at the whole history here. But we do see that a lot of vulnerable groups were doing slightly better in spring 2025 than they were in spring 2024. So I'm going to talk about that in more nuance in the next few slides. So looking closer at what drove this admittedly modest improvement in financial health over the past year, we see that 2 of our indicators improved slightly. One related to spending and savings, and the other one related to debt. So first of all, the share who spent less than their income over the prior year increased from 47% to 49%. In short, this means that a slightly larger proportion of households were able to save at least some of their money this year compared to last year. This was not particularly surprising to us. We didn't expect to see big changes in this indicator over this time period because there weren't really sweeping policy changes affecting how people would spend or save money over this time period at least. But inflation did cool quite a bit and the job market was relatively strong over this period. So it makes some sense to us that some people on the margins would have found it easier to save a little bit of money in 2025, at least relative to the prior 2 years. But again, a small change. And then second, the second indicator that improved is the share who reported an unmanageable level of debt decreased slightly from 30% to 29%. So again, another small improvement on the margins there. This result may have been driven by fewer people reporting that they had debt. So we see small decreases in the share reporting that they had an auto loan or who had revolving credit card debt, so credit card debt that's actually bearing interest over this time period. We're not exactly sure what may be driving this, but this year did mark several years in a row of relatively high interest rates. So tough to say for sure, but people may have been paying off their debts at higher rates, at least these 2 types of debt, higher rates this year relative to last year, and avoiding taking on new debts in part to avoid those higher interest rates. However, with all of that said, I think it's important to re-emphasize that the small improvements that we saw this year have not made much of a dent in the larger problem that we see nationally. So putting the debt manageability slide back up here for a second, you can see that the share of the population who say that they have unmanageable levels of debt is still hovering around where it was prior to the pandemic. And the same is true with the spending relative to income indicator as well. The small improvements that we did see over the past year were mostly concentrated among lower income and lower wealth households. So low and moderate or LMI households, negative net worth households, households without investments, renters, and Black households were all less likely to be financially vulnerable in 2025 than in 2024. And as further verification of this, we see that material hardships, which are things like food and housing insecurity and the inability to pay utility bills, were a bit less common in 2025 than in 2024. So you can see 1 to 2 percentage point decreases in food insecurity, skipping rent or mortgage payments, and skipping utility bills this year. Okay, so that kind of rounds up all of the, again, kind of modest good news that we saw over the past year. But shifting for a second from the good news to the bad news, there was another financial health indicator that actually decreased over the past year, and that was confidence in household insurance coverage. And this is part of a longer trend of declining confidence in insurance, stretching back to at least 2018 when we started this research project. So here you can see that in 2018, 61% of households said that they were at least moderately confident that their insurance policies would provide enough support in an emergency. And we're talking about all of that household's insurance policies, from health insurance to home insurance to car insurance. And that has decreased from 61% gradually to 56%, the lowest we've seen it over the past 8 years in 2025. In the report, we discuss how this could be related to both the increasing cost and decreasing availability of home insurance, especially in high-risk areas like high wildfire risk areas. It could also be related to the increasing cost of auto insurance that we've seen since the pandemic. And there's also other research that has shown gradually decreasing satisfaction with health insurance coverage over this period as well. So our best guess is that this increasing dissatisfaction with insurance coverage is tracking decreasing satisfaction and increasing costs across a wide variety of insurance types. And then one data point that we have, at least in support of this hypothesis that natural disaster risk has something to do with decreasing confidence in insurance, we see that those who experienced natural disasters or severe weather events over the past year were less confident in their insurance coverage than those who did not experience natural disasters or severe weather events. So those who did experience a natural disaster, 14% said that they were not at all confident in their insurance, versus only 7% of those who did not experience a natural disaster. So clearly more research needed in that area, but climate risk, natural disaster risk may be playing an important role there. And then finally, one really clear policy change that influenced financial health in a negative way over the past year was the resumption of reporting student loan delinquencies to credit bureaus. So I'd be interested to hear from some of our audience whether you're seeing this with some of your clients that you work with. But over the past year, forbearance, as we know, has gradually ended for federal student loan borrowers. And I believe it was in January 2025 that delinquent student loans finally began to be reported back to credit bureaus and affecting credit scores. So unsurprisingly, as a result of that, we see a dip in self-reported credit scores for households with student loans, and comparatively no change in credit scores for households without student loans. So what does this all mean? Well, it helps us clarify some areas of focus for us, I think, over the next year, one of those being insurance. So this gradual decline in insurance confidence that we see really underscores a need for policy and industry solutions that make insurance more affordable and more accessible. Two additional strands of FHN's work related to insurance that we'd encourage you to check out are our work on climate resilience and natural disaster risk. For that, we have a brief that we released last year on strengthening financial health and kind of the connection between household financial health and climate resilience. And then from an employer perspective, our work on essential benefits for employee financial health, of which health insurance is one of the most important financial health supporting benefits. And health insurance, I think, is especially an important focus right now as federal policy is putting health insurance coverage at risk for millions more people in the near future. Student loan borrowers also, of course, warrant close attention, as I was just talking about. So the resumption of collections activities, along with the administrative backlogs and confusion around the changing repayment plans, may further strain borrowers' finances in the coming year. So we call on policymakers to establish flexible repayment pathways for borrowers, and financial institutions, employers, and community organizations should work to identify and predict those student loan borrowers who may already be struggling, guide those borrowers through their repayment options, and make sure they understand the consequences of delinquency and default and collections, since those are changing so rapidly, and then do what you can to provide additional flexibility and support with student loan repayment. So everything I just presented to you is summarized in the executive summary of this year's trends report, but our full report has even more insights on the financial health of over 24 consumer groups. So in the full report, we have financial health trends broken out by financial characteristics, so things like household income, net worth, different types of debt and asset ownership. Financial health trends broken out by demographic groups, race, age, gender, LGBTQ plus status, geography, employment characteristics, and health and disability. We also added in 2025 the experience of natural disaster, which I briefly mentioned, and we also have financial health stats now by union membership for workers as well. So check that out if you're interested in one of these specific consumer groups, and hopefully the charts and tables and figures in there will be helpful for you in making your case for the financial health for some of these groups. I added a QR code there that will actually take you directly to a new site that we're piloting that is a data dashboard that allows you to view financial health disparities by each of these demographic breakdowns in an interactive dashboard. So the URL is there as well, but check that out when you get a chance. So stepping away from our financial health pulse research for a minute and returning to you and how financial health measurement could work for your organization. You could take many paths to financial health measurement at your organization, but here is one way to get started, and I'd be happy to take questions about this because there's really no one size fits all here. But one first step, if you're interested in this, could be to download our financial health score toolkit, which is available at this QR code and that URL there, which we'll make sure you have access to. All you have to do is agree to terms and conditions, and that is free to access. Once you have that guide, you'll be able to embed those 8 survey questions into wherever you'd like to be measuring financial health. So you could embed this into pre-post surveys that are a part of your program evaluation strategy. You could embed these questions into client intake forms. You could, if you're interested in measuring the financial health of your employees, you could embed these into employee surveys. And then you could also use these questions in larger community surveys to conduct needs assessments of the populations that you serve as a whole. And then you can use that scoring framework that's in that toolkit to calculate the financial health of your target population, see what percentage is financially healthy, coping, and vulnerable, see what the average score is, however you want to break down the statistics. And then, since we always make our financial health pulse research publicly available, you can always compare the results of whatever population you're interested in measuring the financial health of. You can compare that target population to our national benchmarks that are available in our pulse research. So just to end with some final thoughts on measurement at your organization. First, as I said, this is not really a one-size-fits-all thing. We encourage organizations to modify our scoring framework as needed to fit their specific needs. So lots of organizations use the 8 questions that we have exactly as we have them to make them comparable to the national statistics. But if you want to take out questions or add questions or modify the way some of our questions are asked, then that's totally your prerogative. And we encourage you to experiment with that based on your client's needs and the needs of your organization. Second, something else you can do is you can consider supplementing the survey data that you're collecting with those questions with administrative data from your organization for a more complete and dynamic picture of financial health. So if you have access to, financial institutions, for example, have access to lots of transactional and financial data from their customers. Community organizations may have access to, other kinds of tax records or other sources of administrative data that either your organization generates or that you're connecting with other organizations, that direct service organizations that you work with. That's always something to consider as well to build out a more say sophisticated financial health measurement strategy. And then finally, we always encourage you to reach out to us for help with scoring methodology and implementation. So we've helped many organizations work through this process in the past, and we're more than happy to take your questions about our scoring framework and how this might look at your own organization. And that was all I had for you today. Thanks so much for your time.
Great, Andrew, thank you. Now let me turn the presentation over to Molly. Molly, you should have control.
All right, let's see if I've got it. Yes, I do. Thank you so much. I'm so excited that Andrew mentioned that there is no one-size-fits-all answer, because that's going to come up at least a couple of times as I'm talking about measuring financial health at NeighborWorks America as well. For those of you who are unfamiliar with NeighborWorks America, we're a network of 249 of the nation's strongest community development organizations located in all 50 states, DC, where I'm based, Puerto Rico, and on tribal lands. We provide our network with flexible funding, training and technical assistance, peer learning, data analysis, and organizational health monitoring. We're congressionally chartered and led by a board of federal, financial, and housing regulators, and have been tapped to administer 2 congressionally appropriated national housing counseling programs. For all of those network organizations all across the US, in DC, Puerto Rico, and on tribal lands, we collect critical data on their work and impact. I'll share a sampling of the data that we collect just to give you an idea of what we gather. We look at organizations' role and services in housing, like whether they're underwriting loans for homeownership, providing realty services, and the number of purchased, constructed, and rehabbed units for homeownership or rental and for sale. The hours of counseling and education that they provide. We look at client data like demographics, veteran and military status, household income, and related financing data. On the rental housing front, our network owns and or manages nearly 212,000 rental units. Looking at home ownership from fiscal year 2020 through fiscal year 2024, our network created and preserved over 155,000 homeowners and supported nearly 44,000 financial capability customers. From fiscal year 2022 through fiscal year 2024, our network counseled and educated nearly 322,000 customers and funded over $1.6 billion in first mortgages, down payment, and rehab loans. So there's a lot going on across our network. In fiscal year 2024, that's the most recent one that we have quality assured data for. The NeighborWorks network created over 16,000 new homeowners, half of which were below 80% area median income, or AMI. And there are two trends for you to keep in mind when you're looking at our data on homeowners created by AMI. 2024 is reported as the worst year for home sales in the last 30 years, and our network is performing slightly better than the larger market. We actually increased our count. So in a time with limited affordable stock and rising costs, our network is still getting people into sustainable homeownership. And the second trend is, regardless of what's gone on in the housing market in the last 5 years, about half of the NeighborWorks new homeowners earn less than 80% AMI. That's something that is consistent. Putting this into the context of the overall market, if you look at the outer circle, the data, the dark maroon section on the left-hand side shows that 52% of all new home buyers in the NeighborWorks portfolio in the last 5 fiscal years were at less than 80% AMI. By comparison, we have the national HMDA data, Home Mortgage Disclosure Act data, in the lighter color on the inside, and it shows that only 26% of home buyers in the general markets portfolio were in that same less than 80% AMI income range. So that means our network is serving customers below 80% AMI at about double the rate of the conventional market. And this example will come up later when I give you some of our tips about how to make the most of your data. So keep it in mind. The last thing I'll share about our network's work before I get into some of the lessons that we've learned the hard way is information about our financial capability impact. So our network, and I should mention before I go into this, that our organizations in Alaska did not report financial capability customers in our most recent fiscal year. So you're not imagining things. We have not lost a state. They did not have customers to report. So the rest of the color coding on our map and the states in Puerto Rico that are referenced here are accurate. But we had overall in all of those areas, 48,200 individuals had some sort of financial capability services. 7,822 of them were tenants in rental units owned by NeighborWorks organizations. So the other, like just over 40,000 would be maybe tax preparation customers, or maybe folks that were looking to purchase a home from the community. Those are some of the other customer bases that we have. And so the organizations all provide different types of services. We had 94 of them providing some sort of financial coaching, 96 providing financial counseling. There's some overlap between those two groups. 104 provided some sort of in-person group financial education. We had 60 that were providing on-demand online financial education. So lots of different shapes and sizes of financial capability programs, just depending on what a community needs. What you might have noticed in looking at that data about financial capability is that you didn't see some financial capability data that you might have expected. There was a time when we tracked and reported impact on individual customer metrics like debt, income, savings, and credit. I'm sure many of you are tracking something similar. We ran into a lot of challenges in trying to collect that information and draw conclusions from it and report it. And so we've changed our data collection process at a national level as a result. So the 3 big challenges that we ran into: 1, we have a lot of organizations in our network that are helping people buy homes. They help folks get an affordable mortgage for their financial situation with stable monthly housing payments that they can maintain and get them on that first rung of the property ownership ladder, which is a big deal for their financial capability. But the thing is, when you buy a home, very often your savings and your credit score go down and your debt goes up. So just looking at the debt, income, savings, credit metrics without factoring in home purchase wasn't really fully capturing the financial impact of purchasing an affordable home and making this gigantic step forward in your financial life. The next challenge that we ran into was that some of our network organizations change people's incomes through workforce development and small business technical assistance. But they're more of the exception than the rule. So we noticed that we weren't seeing a lot of change in income from start to completion of services because that's not a core focus for most of our network. So that data point wasn't really doing much work for us. It was adding a lot of work for our network organizations, and we weren't getting any big exciting conclusions from it. And then last but not least, we have broad geographic and programmatic coverage, as you might have observed as we were going through some of that network data. A great savings or credit score in Kansas City isn't the same as great financial health indicators in New York City. Similarly, a change in savings for someone who is just building up their first emergency savings account and has been really living on the edge financially might not be a very big change in savings for someone who is trying to put together money for a down payment on their house. So the data was really noisy and hard to interpret because these programs were so different and the geographies were so different that we were all lumping together. So here are some takeaways from our experience, and I'll go into a little bit more detail on all of these, but hopefully this gets you thinking about what you might want to track to design your programs and describe them to other people. I would say that if you are looking at data that will be meaningful for your program, you should consider the people that you're serving, the place where you're working, and the programs that you are offering. And what I mean by that is, you know, the people that you're serving, you know a lot about their financial lives. You know, maybe you have an inkling about something and you can verify whether it's true for the customers that you tend to frequently serve. Let that guide you toward what is a meaningful metric for you to collect and track over time. In terms of place, you can use national trends and your local knowledge to understand what your specific community needs. In general, the more narrow you can make your geographic focus, the better your program data will reflect your impact. So anytime you can get a smaller geography, you're getting a more accurate reflection of what your program is. And then coming back to our favorite phrase, one size fits all, in the program section, one size fits all metrics that aren't tailored to your program can make noisy data and disappointing outcomes. So you really want to run with specific data that aligns with your programs and your services. Going a little bit deeper into the people section and what I mean by that, when you're using data and your knowledge of your customers, which is a kind of data and information, you can use that to design high impact programs and track data that tells the story of your work. So one example that comes to mind is we had an organization that was really spending a lot of time talking about payday loans in their communities. Payday loans are legal in 30 states. The overall national estimate is around 4.7 to 5.5% of Americans that are using them. Just sort of depends on how you measure that number. The usage tends to increase as income decreases and with some other socioeconomic factors. And we had a NeighborWorks organization that felt that this was like really a big issue for their customers. And so they were really going to focus on it. They had a whole section of their group education dedicated to this. But they did a survey for one of the, we had like a financial capability pilot program with them where we were asking lots of questions about their customers. And they learned that about 15% of their customers were using payday loans. And when they looked at that data, they realized that it probably did not make sense to spend as much time as they were spending on payday loans in their group education, that they could spend less time on it in the group education and really bring it into the one-on-one coaching and counseling sessions. So for those customers that really are stuck in a payday loan cycle, they can get the just-in-time, high-impact information that they need. And for those customers that are maybe covering shortfalls in cash in other ways, they're still staying engaged in the group education because they're not getting stuck on a section of the education that doesn't really apply to them. The other implication that it had for them is when you're starting with a really low percentage of users, the organization would be better off focusing on how many of their customers who started their service using payday loans were still using them at the end, versus maybe having a smaller change, like saying, 15% of customers reported using payday loans in the last 6 months at intake, 10% reported using them when they completed their service. That almost undersells the impact that you've had on the 15% of customers who came in using payday loans. So that's a really good example of someone who had a sense that maybe there was a lot of payday loan activity happening with their customers. It's true that it's higher than the national average, but it wasn't true that it really needed to be this big, long section of the group education for this particular group financial capability education that they were offering. Something to think about when you think about what you think you know about your customers and where you might just want to double check and see how you might change your program or change the way that you track impact of your program. Going deeper on place and narrowly targeting your geography to describe your impact and design your program to work in your community's specific context. I'll share some examples from colleagues of mine whose whole job is around strategy and impact and business intelligence. NeighborWorks organizations are able to make ad hoc data requests to our national data team and get really in-depth analysis for their communities. And so I have a couple of case studies from our business intelligence team and some tips from them. If you're not a NeighborWorks organization, but you still want to do this kind of analysis, they've shared some resources with me. So here's an example of national compared to state level data on mortgage delinquencies in the state of Pennsylvania. This was a special request from one of our network organizations in Pennsylvania that wanted to know how big of an issue serious delinquency, so more than 90-day delinquent mortgage payments were in their state of Pennsylvania. And they didn't want to just go with a national number. They wanted to know, is this a worse problem in Pennsylvania, or are we actually doing better than the national average right now? And you can see when you look at this data that our team gathered from the CFPB, that there was a time when Pennsylvania was actually doing better. Around 2009 to 2012, they were doing better than the nation at large on serious 90 and more day delinquencies. That has changed a little bit. Pennsylvania seems to be having that slightly higher delinquency rate than the nation at large. And then there was a further level of analysis from our team where they focused on how non-metro areas were similar to the national average. And metro areas, I'm going to apologize in advance for any Pennsylvanians for mispronouncing this. Metro areas of East Stroudsburg and Chambersburg-Waynesboro were twice the national average. It was still a low number, but it's good to know, is this a really big problem in our community or not? And that can help you with your stakeholder communications and maybe gives you some insight and data to back up an uptick in customers that you might have seen experiencing a certain issue. I just want to keep reiterating, if you are a frontline service provider, you know a lot that maybe will take a little bit longer to show up in data. So use your instincts and your sense of where you're getting an uptick and interest to help you look at some of the numbers to back it up. Going even more granular, another request from one of our network organizations in the Metro DC area was to look at this particular county's economic information, like what the median household income was, what the median gross rent was. This is an organization that's offering very specific rental properties in specific census tracts. So now county level data compared to census tract data can be quite different. So it's really helpful to know, for example, if you're looking at county level data that says the median household income is $128,000 a year, but in your rental property census tract, it's closer to $104,000 a year, that can help you figure out exactly what the financial situation is of your customers for your community that you're serving. And the data team has very helpfully noted that this information came from Policy Map, as well as the 2019 to 2023 ACS. We will talk about that in a second, and some HUD data. So these are analyses that you could run, or what I might recommend, especially if you're a smaller organization, is grouping up with other smaller organizations that have similar interests and seeing if you can pool your resources and work with a data scientist or, combine forces and share an FTE to do some data analysis to really make the specific local case for your community. It doesn't mean you can't go play in some of these resources that I will share with you from our business intelligence team. But if it just feels too overwhelming, that might be an option for you. It would be to collectively as a community think about some questions that would be meaningful for your specific geography. So the first resource our data team shared is Policy Map, which does allow for both a paid and a free version of the service. And you can get really granular and isolate information down to the block or census tract level. And you can create custom regions and compare them to larger geographic areas like county or state areas. So that might be a tool that's worth investing in. Maybe if you're going for that paid version, that's an opportunity for people to pool resources for an organization that does have the data scientist on staff or the data nerd if they're not an official data scientist. Another resource that they recommended was data.census.gov. It allows you to browse all of the census data from current and past 10-year census activity. I mentioned the ACS being used in that county to census tract comparison. This is the ACS, the American Community Survey, as well as other sources. And so they've shared this screenshot of an example of selected housing characteristics for housing units without kitchen facilities in Pennsylvania, for example. So that's another good resource if you're trying to figure out what is going on in your specific community. And then last but not least, we use Home Mortgage Disclosure Act data all the time at NeighborWorks. You might have heard this referred to as HMDA before. This is data from many financial institutions about their mortgages. And so we've got links on here for the data browser and a screenshot of what the data browser looks like. And there's also a beginner's guide to accessing and using Home Mortgage Disclosure Act data. So that's a really good way to get into that kind of data. And so last but not least, we've talked about people, we've talked about place, programs. Whenever possible, use data that is relevant to your specific program or services instead of one size fits all financial health stats. So here's an example. People get very excited about credit scores. They seem very convenient. It's just this 3-digit number. It's totally comparable. Let's just track it and see how that changes over time. I get this question a lot from people that I work with. Could we track credit scores and see how those change over time? They may not be the best indicator of your impact if you aren't focusing on credit specifically as an outcome. And so here's an example. If you're talking about like a rent reporting for credit building program, yeah, absolutely. I would say that is something that you should be tracking, is someone's credit score. Or if you're doing coaching and counseling work and you're specifically focused on working on someone's budget so that they can reduce their credit utilization because they have this credit score goal, a credit score can be great at tracking progress over time. For other programs, like an eviction prevention program where you're serving someone in a crisis, their primary goal, the primary goal of your service, is not really improving underlying credit scores. You're trying to get them to stay in their house. So don't fall for the trap of one size fits all metrics. And now that I've said all of that, I'm going to go a little bit against it and share a bonus tip from some of our network organizations. We've had several network organizations that have had success getting folks in the door for financial coaching by offering to pull their credit score and review their report at no charge to the customer. For some reason, having someone with training offer to pull your real credit score and actually go through your report with you actually incentivizes people to show up for that first financial coaching appointment. Even if they don't really know what their financial goal is yet, they've just sort of heard they need to work on their credit score. And if you don't know where to start, that can be a really helpful draw to get people in the door. Then I've got 2 examples from our network organizations of different ways that their programs determine what kinds of data they collect. So the first example is from NHS of Baltimore. This is a fantastic organization that integrates their financial capability program with their homeownership program. You don't have to be interested in home purchase to be in the program, but since that's the origin of where their financial capability program started, homeownership does drive a lot of their graduation metrics. For a lot of people, homeownership can feel totally out of reach because they have low credit or high debt or limited savings, and it can just feel impossible. But when they go to NHS of Baltimore, everyone starts out with an 8-hour financial education class. It's focused on very practical information. It's accessible. And when clients finish, they get a certificate that many mortgage lenders require to be able to initiate the home purchase process. After the course, they sit down one-on-one with a counselor who walks them through their income, debt, and budget. Some people at the end of that are ready to buy right away. Many aren't, and that's who they also have this fast track program built for at NHS of Baltimore. So fast track focuses on 3 big barriers: credit scores below 680, budgets that are out of balance, and savings under $5,000. Again, all driven by those homeownership needs that are specific to Baltimore. With coaching and support, people make progress. It can be as fast as 90 days. For other people, it can take a lot longer. They don't put a limit on it. Karima Pinder, who is a true rock star program director at NHS, describes it as everyone's in a different lane on the same highway, just keep moving forward. So participants get help setting goals, understanding their spending habits, and working through complicated financial situations, maybe including some family obligations that are getting in the way of their financial health. And then when they graduate from the program, because this program originated in homeownership, in order to graduate, they do have to have at least $5,000 in savings, and they have to have a credit score of at least 640, potentially as high as 680, depending on their specific financial situation. Throughout the program, because again, this is homeownership oriented, they are getting their debt to income ratio measured. That's a metric that is specific to homeownership. Knowing what they know about this population and about the lending products available in Baltimore, you don't have to get your debt to income down to 0. The goal is just to make some progress and chip away at it so that you're in a better position when it's time to buy. I have gone to one of their graduation ceremonies. They're wonderful. There are people who come through there and say, I didn't really think that homeownership was in the cards for me. I assumed that it was totally out of reach until I was just going to improve my financial health by being here. That was all I was here for. But then when they go through the program and see that it's actually possible and see some of the homes they can buy in Baltimore, they change course, and it does become something that is more of a dream for them than when they started. We have a similar homeownership and financial capability program at East Akron Neighborhood Development Corporation. They shared that they set their graduation benchmarks based on what they know about local lenders' products. So they know in their community what a person's credit, savings, and debt to income ratio needs to be to take advantage of down payment assistance and other local programs. And that is how they choose. So your graduation means something. When you graduate, hey, did you know you're also eligible for a lot of interesting homebuyer assistance programs? Going in another direction, another one of our network organizations, CHN Housing Partners in Cleveland, recently opened a Scholar House program. It's called the Louise C. Stokes Scholar House, and it's designed to support single parents who are pursuing post-secondary education while also giving their children a strong early start. At this point, the property houses 30 families. When it is fully occupied, it will serve 98 people. At its core, it's a 2-generation model. So the idea is when the parents and children are supported at the same time, the entire family has a better chance of long-term stability. And this model is based on strong evidence from other scholar houses around the country. In Northern Kentucky, for example, the majority of children in their early childhood program entered kindergarten on track, and families showed progress across several measures of self-sufficiency. In the Kentucky Family Scholar House Network, most parents completed college credits, many earned their degrees, and the vast majority moved on to stable employment. So housing stability is a major part of the picture. It's the jumping off point. Nationally, more than 1 in 5 single parent college students report struggling with housing insecurity. At scholar houses elsewhere, nearly all residents entered with unstable housing, and almost all exited into stable homes. So CHN is adopting this model. They opened their Scholar House to residents in late 2023. The building has affordable housing, on-site daycare, and an early learning center operated by Step Forward, as well as family coaching, a technology center, community and fitness spaces, and areas for children to play. So throughout all of this, supportive services are a central part of the experience. Each family participates in one-on-one coaching twice a year to set goals and track progress. Weekly two-generation activities are offered, and families are asked to take part in at least 2 each month. A resident advisory council is forming to help guide programming. They also have additional support like food pantry, a care corner, a computer lab with digital skills training, and academic partnerships with Tri-C, Cleveland State University, and College Now. And so you can imagine this program is not going to use the same metrics that our colleagues in NHS of Baltimore were using. This is a totally different audience that they're serving. The program is totally different. So the metrics that they use are something called the Arizona Self-Sufficiency Matrix. And that matrix overall evaluates a resident's ability to live without public assistance at a given point in time. So each year residents complete the annual survey, which has a lot of different domains. And then additionally, they complete 2 coaching sessions each year where a family coach collects people's self-assessed Arizona Self-Sufficiency Matrix scores for 5 domains. And then they kind of talk through it together and see if maybe the person undersold themselves or oversold themselves on some of those 1 to 5 rating criteria. The 5 domains that they collect twice a year, excuse me, are income, employment, savings, housing, and education. And so their goal was for residents to retain a score of 3 out of 5. And they found that in their first year of doing this, most residents came into Scholar House in the 3 to 4 range, but across all domains, their clients have reported an average increase of 0.25 to 0.5, excuse me, in their first year. And they're well over their goal of hitting an average of 3. There's a lot, a lot more to say about this model. I am not the full expert on it. I am sharing information that was shared with me from Nina Holzer, the Director of Financial Mobility at CHN Housing Partners. If this is something that you're interested in learning more about, she has graciously shared her email address so that you can reach out to her. So this is a totally different set of metrics. It's tailored to a totally different type of program. It's meaningful and makes sense for them. One of the things that Nina shared with me is that her coaches also got a lot of use out of using these ratings on these 5 categories. It helped them figure out if there was something happening under the radar that wasn't coming up in their conversations, maybe around that savings or employment piece. It hadn't emerged naturally, but just doing that rating exercise twice a year was a good chance to say, oh, I didn't know that you were struggling with this. Let's talk about what some of the opportunities are. And I've also got a link in here to the Arizona Self-Sufficiency Matrix if you want to see how they categorize scores of 1 through 5. So bringing it all together, be inspired and informed by national trends and tailor your data to the people you serve, the place you're providing the service, and the programs that you are offering to have the greatest success. Before I hand the mic and the clicker back, I, of course, have to promote that we have our next NeighborWorks Training Institute taking place in Chicago in February from the 23rd to the 27th. Registration is open. We do have more than 70 courses there around housing, counseling, community development, real estate, management, and leadership. We have a certification in community economic development that includes a 1-day course on measuring community economic development that may be of interest to some of you. Early bird registration ends on December 14th of 2025. So you want to make sure that you get the early bird pricing if that's something that you're interested in. And I think that's it for me. I'm handing it back to Linda and Nelson, right?
Yes, thank you, Molly, and thank you, Andrew. Presentations were awesome. You guys rock. Okay, audience, now it's time to hear from you. It's not too late. You can still put that question in the box and send it over to Nelson. Nelson, are you ready? I know you have a ton of questions for our audience.
Hi, Linda. Yes, can you hear me okay?
Yes.
Yeah, we do have questions and some feedback. A lot of people are saying what great information, and they're looking forward to receiving the slides. So I let everybody know that the slides will be sent out in about a week. And I do have a question. One of the persons is asking if any data has been collected on title loans. They mentioned that they do a call-in radio show from time to time for Horry County, South Carolina, and they have a huge problem with title loans and people losing their cars. Has any of that been collected the way it has for payday loans?
A really good resource for car title loans is the, Center for Responsible Lending. I know their acronym is CRL. I'm just double checking right now that it is the Center for Responsible Lending. They do a lot of reporting on payday lending, title loans. They also have done a lot of reporting around tax anticipation loans. So that would be the first place that I would go to. I know that I've seen something from them recently about title loans. I don't have it front of mind, but I would definitely go to the Center for Responsible Lending.
Excellent. Thank you for that tip. Another
And I'll
question.
just
Oh yeah,
add,
please go ahead, Warren. Andrew.
yeah, mind if I jump in? I'll just add, if you want national statistics on like the percentage of the population in the US who are using auto title loans on an annual basis, the FDIC's annual unbanked and underbanked report publishes statistics on the use of all sorts of alternative financial services, including payday loans and auto title loans. And then our research at the Financial Health Network, we have an annual report called the Financial Health Spend Report, where we also look at the use of a wide variety of financial services, both mainstream financial services and alternative financial services, and report out not just the percentage of the population using them, but the average, the total amount that consumers are spending on average across all of those individual financial products. So you can also check out those stats in our financial health spend research.
Excellent, thank you. Another question that we have is, does NeighborWorks America provide survey data to non-member organizations, maybe for a fee?
We don't, but I would be happy to suggest that to our business intelligence team. Seriously, what I would recommend is if you've got a NeighborWorks organization in your community, sometimes NeighborWorks organizations don't even know that they can submit ad hoc data requests to our team. They can't do it like on behalf of you, but if you guys have a mutual interest, you might want to make them aware of our ad hoc data services and let them know that they can ask NeighborWorks to do a special analysis on any of the joint projects that you guys might be working on. I got in trouble the last time that I mentioned that to someone because a non-network organization like forwarded a request to a NeighborWorks organization that just got forwarded to our data team, and that's not really how it works. It does have to be something that the NeighborWorks organization is already doing or interested in. It's got to be something collaborative.
Excellent. And yeah, people again continue to ask about the slides and this training itself. I should say that in a week we will send out the slides, and also a recording to this webinar. So you'll have both the slides and the recording link. It'll end up on our YouTube page within the week. Another question we have is, have any of the cuts at the CFPB affected availability of some of the data that's being discussed today?
I feel like Andrew probably has an answer to this that's better than mine.
Or cuts maybe not the CFPB,
Yeah, that's
but elsewhere.
Yeah, good question. There's definitely, so not our data. So our data collection is funded by the Principal Foundation. We don't receive any federal funding for that at all. So luckily, our data collection efforts have been unaffected by cuts at the federal level. There are important sources of data from the CFPB that we use sometimes. In particular, their Making Ends Meet survey is a very helpful national survey of household finances. I do not believe that has been affected by cuts yet, but I'm not sure. I know they just recently made some of that data publicly available for the first time, which is great, actually. And frankly, I'm not totally certain what lies in store for the future of that.
Okay. Thank you, Andrew. And also, if I could ask you, Andrew, to speak up just a little bit, because when your voice turns a little bit soft, it fades out a little bit. So just keep your volume high for this.
Sure.
Just a little bit of a follow-up to earlier. Can any nonprofit organization become a member of NeighborWorks America, or is it just housing counseling organizations?
It's not just housing counseling, but it's a challenging application process. I am not on the team that actually filters through these. I know that we just had a couple of new organizations affiliate, and it takes a while. It's a big deal. Again, the best way to stay, and we only open it up every couple of years. So the best way to be engaged is to be aware of your other similar local organizations that are part of the NeighborWorks network. We have folks that are based across the country that will sometimes know which organizations are making a big difference in community development, housing, economic development, those kinds of things. And so sometimes they'll also make a point to make organizations that are not yet affiliated aware of the affiliation process, but it is not for the faint of heart.
Okay, good to know. Thank you. And this might be for Andrew, since you mentioned insurance earlier. This is just really a comment, I guess. They say the insurance industry still keeps rates so high, yet they spend so much on advertising. Why can't they cut marketing and lower insurance costs? Way too many commercials, they say. Is this anything that you all are working on the advocacy side of things, Andrew, or do you have any feedback on that?
No, not really. I don't have a lot of expertise into where insurance companies are spending their money or their marketing strategies or anything like that. But it's an interesting question. And if I have the ear of an insurance company sometime in the near future, maybe I'll have the chance to ask them.
Great. Another question we have is, how can we easily find data comparing how many jobs are created in commercial space versus how many housing units are created in residential developments? It seems difficult to find this type of data. Any thoughts on that?
If you want to, I can try to find that. I don't know if there's an answer, but sometimes when I email our business intelligence team, I'm very surprised where they'll be like, oh yeah, that's tracked by the annual national whatever database. So I don't know it offhand, but I think it's an interesting question, and I'm happy to ask our data team and come back with an answer at a later date.
Excellent. Yeah, this is something we can try to get back to the person asking. If you want to email us directly, we can follow up on this and see if we get an answer. Another question, Andrew, you talked about insurance, including medical. Do you expect to see, what do you expect to see in light of the looming or the threatened medical cuts? What do you expect to see, I guess, after such cuts take place in terms of the data you offered earlier?
Well, I'm concerned that we'll see a continued decrease and potentially a very sharp decrease in confidence in insurance coverage, to say the least, as people continue to lose their health insurance coverage and as it becomes more expensive. And it could also have cascading financial health impacts on some of those other indicators as well. So, as people are spending more for the same level of health insurance coverage on will see, say the ACA marketplace or through their employer. Speaking about health insurance anyways, specifically, that's going to eat into other parts of their budget, which may make it more difficult to save, may make it more difficult to pay off debts, may make those debts less manageable. And so we may see other decreasing financial health indicators as well. So, and in general, we're on the lookout for what might be a difficult road ahead for financial health in general over the next couple of years.
Okay, great. Thank you. Does FHN offer trainings or put on periodic or maybe quarterly trainings on using the measurement tools, the measurement tools that you discussed today?
Nothing so formal as like a standard training. We don't offer anything standard like that. But as I said, please do get in touch with us if you're interested in talking. We've had many informal conversations about ways you could use, ways organizations could implement the financial health measurement framework or modify it according to their needs. So everything ranging from informal conversations, which we're happy to have, all the way to formal consulting engagements, building out a whole financial health measurement strategy at your organization. We've engaged in those as well. So don't hesitate to reach out.
Excellent. Thank you. Also, Molly, you talked about how, offering the review of credit scores might be a way to bring people in the door. Do you have any, either of you have some tips, best practices in terms of how to keep people coming through those doors so that you could do post training or post education surveys? Some of the things that we've heard over the years, I should add, is that people or organizations survey their clients, but then aren't able to keep them as clients or lose track of them, and can't get that post education data or responses to questions. Have you had any experiences or reports from community organizations as to how they handle that?
I have two tips.
Yeah,
I have two tips. One of them is we have one organization that offers like gas or grocery cards. I want to say it was like $20. It doesn't have to be an enormous expense, but a $20 gas or grocery gift card for people who complete their surveys. I think sometimes they do them as raffles. NHS of Baltimore, that housing counseling organization that I mentioned, their graduation ceremony is it's really fun. It's a really fun way to keep people engaged. And I remember at the one that I attended, the graduates were saying when Karima, who was at that time a financial coach, when Karima texts, I text her back. Like having that really deep relationship with her helped them stay engaged. And she was using that coaching approach of having customer-driven goals. But the graduation ceremony was like something to look forward to. The one that I went to was not like a crazy expensive sort of thing. They had a make your own taco bar. They had the board of directors invited to attend, and then graduates could invite friends and family. And there were maybe 20 people who got to come up and say a few words about the financial health journey that they had been on and take a picture and just really recognize their hard work. And so when you have something really fun like that, at the end, it's also a good way to stay engaged with people and make sure that they fill out their final survey. You can put a little bit of pressure on them as they're enjoying their tacos.
Are there any write-ups of those kinds of, what you just described, things like that written up or newsletters that maybe we could share with the attendees when we send out the follow-up materials next week?
Yeah, I'll check around and see. Sometimes we have blog posts on things like that where we talk about keeping folks engaged. I'll poke around and see what I can find.
Great. Yeah, we'll be mailing everyone a bunch of handouts in about a week. Another question we have is, are scholarships or financial assistance available for attending the NeighborWorks training in Chicago?
Yes, and it depends on funding availability. Let me double check on so sometimes it'll be really specific. It'll be like you have to be this type of organization for these very specific classes. I'll see if I can find the link with our scholarship information, and I can also share that with you if I track it down, Nelson.
Okay, great. And then Andrew, we talked a lot about housing counseling organizations today. What kinds of non-housing counseling organizations have you seen successfully use the measurement model that you talked about?
Well, let's see. The type of organization that's adopted it the most widely has probably been financial institutions in our membership network. So that's institutions ranging from very large national banks to small regional banks to very small credit unions. We've also, I'm trying to think of like a nonprofit partner that I know has used the financial health scoring framework. Habitat for Humanity is one that comes to mind. I believe housing counseling is actually an aspect of the services they provide, but they have adapted the financial health score framework to their own needs. They've changed some of the questions to meet the specific program outcomes that they're shooting for, like Molly talked about. So that's the most prominent nonprofit that comes to mind.
Okay, great. And then do you have any additional information on, you talked about how employers can use it with employees. What else can you tell us about how employers are using it with employees?
Yeah, so employers are a big emerging focus for us as an organization because we know that financial health is really tied to employment for a lot of people. And it's not just about wages, it's about the benefits people can access at their workplace. The insurance, the retirement savings benefits, emergency savings benefits are becoming more common. Access to things like short-term credit through the employer is becoming more common. So this is really a rapidly changing space that we're tracking, and it's something we're encouraging more and more employers to do, is to survey the financial health of their employees and not only measure the financial health of their employees, but actually ask their employees directly, what kinds of supports do you need to become more financially healthy, so that they can tailor their benefits packages to meet their employees' specific financial health needs.
Okay, great. If I could just ask, is that usually voluntary then on employees? Typically, is that what you're finding? Employers make it voluntary?
Surveys, you mean?
Yes. Employee participation
Yes.
is typically voluntary.
Yeah, always. And I mean, I would say, survey participation any type of data collection should always be voluntary. As Molly mentioned, incentives can really help with survey participation. But yeah, ultimately, it's always voluntary.
Okay. A related question just came through. Do we know of many employers offering DPA benefits, especially those with scaled amounts based on distance from the workplace?
I have heard of an example of this was years ago, an example in Washington of a university that was offering down payment assistance for their employees. I have not heard an example since then. So I don't, and I am also, I do financial capability broadly. So I sort of dabble in home ownership as long as it overlaps with financial capability. I don't want to say it's like super rare, but I haven't heard a ton of examples other than that one university in Washington. I think there's a little bit of an appetite from people and an interest in seeing, for example, if large healthcare systems want to engage, and it does seem like large healthcare systems are interested in employee housing, whether they are thinking of rental housing or home ownership and exactly what mechanisms they would use, I'm just a little bit less certain of. I don't know if others know of examples of employer down payment assistance.
Yeah, I don't know of examples off the top of my head either. I could ask our employer-focused team and get back to you, though.
Great, thank you. And just to wrap up the employee-related question or employer, someone is just commenting, how realistic is it that employees will divulge any information regarding their finances? In today's environment, anything can be used in career decision-making by employers. The information sharing you're suggesting is a slippery slope for the employee. Is that the case, or any thoughts on that?
Yeah, it's an interesting point. I don't know if of any examples of employers we've worked with who have encountered that challenge, but again, it's something I could take back to our workplace team and pose as food for thought for them.
Mm-hmm. Okay, and then Andrew, someone is asking you, they said, do you ever find that the objective financial metrics you get diverge from the subjective measures of financial health?
Yeah, so our framework really has both objective and subjective questions in it, and I think there are pros and cons to both. So an example of an objective question would be our question asking people, how they're spending, whether they're spending more or less relative to their income, and our question about credits. Well, sorry, the credit score is a subjective question. Our question about levels of short-term savings would both be two examples of more objective questions. But then we have other subjective questions like, our question about long-term savings is essentially how confident do you feel like you are on track to meet your long-term savings goals? And that's a very subjective question that can really flex to whatever that person's long-term savings goals are. There's definitely, advantages to using more objective metrics for certain kinds of consistency, and there's advantages to using subjective metrics if you want to get directly to the heart of people's priorities in what you're measuring. The only way to measure whether someone's on track to meet one of their goals is to get their own personal perspective on that, right? So it really just depends on what your measurement priorities are. I would say, I guess to your question about whether they move together or apart, in general, I would say our objective and subjective metrics tend to move in the same direction nationwide when they move. It's not a matter of some years the subjective metrics go up and the objective metrics go down. We haven't seen any patterns like that necessarily.
Okay, great. Thank you, Andrew. And I'm going to wrap up with hopefully just one quick question for each of you. Andrew, someone is asking, is there much research focused on the impact of financial trauma, for example, eviction as a child, on a person's financial health?
Yeah, that's a topic that I've heard come up in conversations. And, I would say there's definitely quite a bit of research out there on the connection between finances and mental health and stress. And so there's a whole research literature that you could check out there if you were interested. We have not done any research on financial trauma specifically.
Great. Yeah, thank you for that. And just so that we can wrap up and not go over too much here, one more question, Molly. Has neighborhood NeighborWorks and its members been negatively impacted by recent federal agency budget cuts? Has there been a decline in overall membership or in your ability to offer services?
I think this is similar to the information that Andrew was sharing earlier about the CFPB data. It feels like we're getting a lot of information, but I don't actually know that enough solid actions have taken place to really feel the impact right now. It feels like just yesterday that we were talking about managing the uncertainty around COVID-19, this novel virus, and having to navigate virtual appointments. And now it feels a little bit like we're having a very similar discussion about just navigating uncertainty, programs that we felt very confident in, that we're just trying to stay up to date and make sure that people are in a position to take advantage of them. So I think it's a little bit too soon to really see the full impact, because a lot of those changes, the dust hasn't settled yet. I do also want to make a quick plug on trauma-informed financial coaching. NeighborWorks does offer a course on this. We don't have research on it, but we offer a course on it. It's called HO 385, Using Trauma-Informed Skills in Financial Coaching. And so if this is something that's happening with a lot of the folks that you serve that have maybe a history of eviction or financial abuse or something like that, this can be a way for you to think of how to make your program feel more welcoming and comfortable for them so that they actually stick with it.
Yeah, if you have a link to a flyer or anything like that, we can include it next week. Kind of related to that, somebody here just comments, money seems like a cut and dry discussion, but it can be a very emotional topic, they say. So if you have resources like that or information about trainings, we'll share it with everyone next week. And I'll turn it over now back to Linda to close us out. Thank you, Andrew and Molly.
Great, thanks, Nelson. And let me join Nelson in thanking Andrew and Molly for your awesome presentations. If you've enjoyed the webinar today and wish to support consumer action, there are several ways to do so. Donations can be made via a credit card or PayPal. Just click on the link below, or you can scan in that little bar at the bottom, or you can do so by visiting our website at www.consumer-action.org/giving, or you can always mail a check to us at Consumer Action Attention Membership Giving, 57 Post Street, Suite 708, San Francisco, California. And another impactful way to support us is by subscribing to our YouTube channel. Subscribing is entirely free, and it comes with several benefits. You will receive notifications whenever we upload a new video that you can view free. And your subscription would help signal to YouTube that our content is valuable, and that will help enhance our visibility to a broader audience. Once more, a huge thanks to our guest speakers for their outstanding presentation. You rock. And a special thanks to all of you for taking time out of your busy schedule to be with us today. It is your support and participation that make our events successful. And if we meet your expectations, we want to know that. So before you leave, please take a moment to complete our evaluation form. Your feedback is not only welcome, it is crucial in helping us improve and provide you with the best experience possible. Wishing you an excellent rest of your day. Goodbye and thank you. And I'll see you again on December the 9th with another presentation on assessing the impact of climate change on LMI consumers. Looking forward to seeing you again. Thank you.